Hello, I'm Dr. Morie Gertz, and I'd like to discuss with you today the role of allogeneic stem cell transplantation in the management of multiple myeloma. I'm a professor of medicine at the Mayo Clinic in Rochester, Minnesota, with over 30 years experience in the care of our patients with multiple myeloma. The decision to proceed with an allogeneic transplant, a transplant from a brother or a sister or a parent or a sibling or a matched unrelated donor, really depends on resource availability for other management tools in multiple myeloma. In the United States, particularly at Mayo Clinic, the utilization of allogeneic transplantation has fallen dramatically over the 15-year period from 2005 through 2020 because of the increased availability of alternate, less toxic tools available for the treatment of multiple myeloma. In areas where access to new agents such as CAR T therapy, belantamab, bispecific antibodies, selinexor, the utilization of transplant has gone down because although transplant can be curative in a high proportion of patients with leukemia, its utilization in multiple myeloma results in long-term survival in approximately 10% of patients and at the expense of serious complications such as chronic graft versus host disease. In areas where resources are not available, it's common to apply allogeneic transplant after failure of alkylating agents such as melphalan and cyclophosphamide, proteasome inhibitors such as bortezomib, and immunomodulatory drugs such as lenalidomide and pomalidomide. But in regions where we have access to panabinostat and daratumumab, isatuximab, and new investigational treatments, the utilization of allogeneic transplant has fallen. Why is that? Well, current techniques to treat patients with allogeneic stem cells can result in long-term benefits, but only for a small minority of patients, which seem to be able to elude the powerful anti-myeloma effect of allogeneic stem cell transplantation. Unfortunately, there's a high incidence ranging from 30 to 50% where the donor white cells recognize the patient as being different or foreign and will launch an attack on the skin and on the liver and on the bowel, leading to chronic graft versus host disease, which can be a severely debilitating complication associated with stem cell transplantation. So although stem cell transplantation is a viable option that can provide meaningful benefit to a minority of patients with multiple myeloma, our recommendations at Mayo Clinic in Rochester, Minnesota, is to seek alternate options, including participation in clinical trials, the utilization of some of the new BiTE therapies or CAR T therapies, which can have profound effects on the multiple myeloma, providing long-term benefits without the risks of chronic graft versus host disease. Thanks so much for your attention.